Welcome back. September marks Prostate Cancer Awareness Month. Here to discuss the effects of the deadly disease is Dr. Kara Watts, Associate Professor in the Department of Urology at Montefiore Health System and Albert Einstein College of Medicine. Dr. Watts, thank you for joining us.
Thank you so much, Kibin. It's a pleasure to be here today.
So, it is clear to most individuals how life-threatening cancer can be, with prostate cancer being one of the most common cancers for men. According to your research, 1 in 9 men will be diagnosed with prostate cancer in their lifetime. To begin, can you first explain what it is and how the cancer affects men?
Absolutely. So you are correct in that prostate cancer does affect about 1 in 9 men. And the word cancer is very scary to a lot of people, but it is important to know that although it's incredibly common, it is not one of the common cancers that kills men. So prostate cancer develops in the prostate, which is a very small gland that sits just below the bladder in the urethra, which is the channel that you pee through. And it tends to form in older men. Typically, the average age of diagnosis is around 65 or 66 in this country.
Perfect. So I understand for Black men, this can be a greater issue. In the Bronx, Black men seem to have a greater mortality risk of prostate cancer compared to their white counterparts. Why do you think we see these patterns within the Black community?
So this is actually a really important point. So we do know from a lot of studies that prostate cancer is more aggressive, or it can be more aggressive in Black men compared to white men. And in addition, Black men on average are diagnosed at a slightly higher stage or grade of prostate cancer, meaning when Black men are diagnosed, there's a higher chance that it may be spread outside of the prostate as opposed to still contained within the prostate. Some of this has to do with genetics, and some of it has to do with the actual tumors themselves. There's a lot of studies looking into some of these differences, but it's important to get screened and get checked out, especially if you're a Black man.
Is there a possibility that pre-existing conditions affect this in some way?
So another really good question. The biggest risk factors for prostate cancer, in addition to just age and race, as I mentioned, are if you have a family history. So specifically, if you have what's called a first-degree relative, like a father or a brother, or maybe an uncle who had prostate cancer, then you are at a higher risk of having prostate cancer yourself. Also, if you've had anybody in your family with certain other cancers, such as breast, lung, ovarian, or pancreatic cancer, there are some syndromes that are associated with prostate cancer. So it's important to know that about your family history as well.
And can you tell us about Montefiore's enhanced screening efforts?
Absolutely. So Montefiore, because of where we work and the diverse population of patients that we treat, is very familiar with these increased risks, especially among a number of our patient groups here. So we have several community outreach events. There's even one coming up this weekend that are focused on enhancing community screening efforts for men and to raise awareness of prostate cancer. We also have additional tools at our fingertips within the Department of Urology to help screen and increase the sort of men's risk stratification. So whereas medical doctors may check a man's prostate by a physical exam, such as putting a finger in the bottom to examine the prostate, or maybe having a blood test called a PSA blood test checked, we in the urology department also do additional tests such as MRI scans. It's a type of an X-ray scan of the prostate, or we may do other special blood tests to increase look at the risk that each man has for prostate cancer.
And I understand that several men underwent a fusion-guided biopsy at Montefiore. Can you just explain what that actually means and how does it help your studies?
So yeah, that's a really great question. So fusion biopsy is kind of a fancy name for a specialized type of prostate biopsy. So we can only find prostate biopsy or tell someone they have we can only find prostate cancer if we do a biopsy of the prostate. So the typical prostate biopsy is a little bit intimidating and maybe a little scary sounding to men. It's something we do mostly in the office, where we put an ultrasound instrument in the bottom to see the prostate, and then we take little tiny samples of it, which get reviewed by the pathologist. So they look at the actual tissue under the microscope and say if there's cancer there or not. When we talk about fusion biopsy, what we actually do is we have a special machine that's new within the last maybe 7 to 8 years, and it's new to Montefiore in the last 5 years, where we actually guide our biopsy based on a man's MRI or sort of X-ray scan of the prostate. So if you as a male have any areas on your MRI that look worrisome or suspicious for prostate cancer, we will use this machine to guide our biopsy and directly sample those areas in your prostate. And it helps us have a better way to diagnose and find your prostate cancer, but also to counsel you about your risks even before the biopsy as well.
Now, I understand, for breast cancer, at an early age, you're told these are some signs that you can look for. What are the signs for prostate cancer, and when should men begin looking for them?
So that's a really great question. And part of the tricky thing with prostate cancer is it doesn't often cause a lot of symptoms. So some men might have, some urinary symptoms bothering them, like frequency going more often or feeling like they have to run to the bathroom. Maybe, although rarely, they may see some blood in the urine when they pee. But most of the time, prostate cancer really doesn't cause symptoms unless it's really advanced, meaning like a higher stage of disease or even spread. So it's even more important that men or their loved ones or partners or sort of family members just know that this is there and it's what their risks are, and ask about being screened, because you're not necessarily going to have any symptoms to know that that's what's going on.
And is there a specific age that these men should be getting screened?
So that is another really good question, because depending on who you ask and what guidelines you look at, the answer is a little bit different. So I go sort of in our practice here based on our urology recommendations, based on our national guidelines. So for men who are 50 and above, we typically open up the conversation to getting screened for prostate cancer. However, if you are in that category of men at a higher risk. So again, that would be if you are Black, if you are have a family member who had prostate cancer, or if you have a family member who had one of those other cancers I mentioned, such as lung, ovarian, colorectal, or pancreatic, then we typically recommend considering starting screening even at age 45. And this is worth a discussion with your healthcare provider, because it's important to be informed ahead of time and make that decision together.
So I was just going to mention that since Black men are more susceptible towards getting the cancer, you just mentioned they can start a little bit earlier. Is there anything else that they can do to help protect themselves?
So I think, there are some data out there showing some protective effects against prostate and inflammation in the prostate, which can, in small circumstances, lead to prostate cancer. So some of the behavioral things are to keep your weight at a sort of normal level. So lower fat diets, avoiding being overweight or obese, staying physically active. There's a little bit of data that green tea can be protective. And avoiding a lot of like animal meats or proteins can also have a small protective effect as well.
Now, I also understand that this can be a very overwhelming situation, and it can sometimes be a little scary to kind of take that first step. Do you have any advice, just encouraging people to kind of take charge of their health despite, the scary outcome that could happen?
Yeah, it's a really great question. I think that the best advice I can give you is that you, as the patient, are your best advocate for yourself. So having knowledge is power. So now, if you have the knowledge that prostate cancer is a possibility, and here are the risk factors. You are your best advocate to just go and ask to get screened. And most of the time it just starts with a simple blood test. It can be done with your regular routine blood screening. It's not anything extra. It's sort of not terribly uncomfortable for most people. And most men don't have prostate cancer. So, it's sort of peace of mind to find out if your numbers are normal. But if they're not, then you have a great team here at Montefiore, or, maybe with a network with your primary care provider that will definitely be there to help you, guide you through it. And there's a lot of prostate cancers we find that we don't even treat. They're low risk prostate cancers. So I think a lot of men have fear of what they may have to get for treatment if they're found to have prostate cancer. But we don't even treat all prostate cancers. We monitor some of them, but it's still important to know about them. So you won't know unless you get checked out.
And what services does Montefiore have to help, and how can people get in touch?
So we have our primary care physician network that is certainly sort of the first line of defense in terms of advocating and making blood tests and PSA screening available for men. We also have our Department of Urology. We have a number of us who see men for this condition to screen, diagnose, and treat. We have very skilled surgeons if that is necessary. So you just, if you want to be screened, I would first check with your primary care physician. But if you don't have one, then give us a call. We'll be happy to see you and help put some of your fears at bay.
Thank you so much for joining us, Dr. Watts.
Thank you. Have a nice day.
We'll be right back with more Open BXRX Tuesday.